So last week, I explained our process for investigations and contact tracing. As a reminder, case investigation is the process of conducting a thorough interview of each person who tests positive for COVID-19 to identify their infectious period and everyone that they came into contact with during their infectious period, and what they need to know to do now to prevent any more infections or exposures. Contact tracing is the process of reaching out to those people who were exposed to the case and providing them with instructions on what symptoms to watch for, how to protect those around them, what to do if they develop symptoms, and how and where to get testing if they do develop symptoms. Investigations take extensive training and a specific skill set before staff is ready to work independently. These new staff that we've hired will shadow existing investigation staff until they can work without assistance in about 3 to 4 weeks. We plan to begin using a text-based system to reach out to positive cases once we learn of their positive test results so that we can reach out to cases as quickly as possible. Here's how the process is going to work. As we are notified of the positive test result, these individuals are going to receive a text message from Public Health providing them with a link to a form where they can submit very basic information like what symptoms they are experiencing, and so they can receive information on how to prevent the spread of their illness to other people. They're also given a phone number so they can speak with a medical professional to ask any specific questions that they have. The text is going to include a web page with more information on how to verify that the text message is true and actually from Public Health, and some additional information on how to take care of cases and their families. The information that people provide to Public Health through this survey is encrypted, and that means it's highly secure, and it will also help the investigator get through the investigation more quickly, which will maximize efficiency for all of Public Health and for the person getting interviewed. So within a few days of getting this text message, the person who tests positive will then receive a phone call from a public health investigator who has access to the information that was submitted securely, and they will conduct a thorough interview of that individual and answer any additional questions that the person has. So the process of the text followed by a phone call will get people important information right away so that they can begin to protect themselves and their family from the spread of the disease, and also allows Public Health and our investigators to work as efficiently as possible. We understand that some people may be concerned about whether a text that they receive is real or not. So we've put a lot of mechanisms in place to make sure that you know that we are protecting your information, and ways to help people verify that the text that they receive is real and trustworthy. So first, the text will include a phone number to a hotline where they can talk to a medical professional about their situation. The hotline number is also included on our webpage for people with COVID-19, so that you can go to our maricopa.gov webpage, look at the hotline, and you can see that is a legitimate hotline performed by Public Health in partnership with Banner Poison Control. That webpage is also included in the text, and it is short enough so that people can actually type it in themselves to verify that the link is real and safe instead of just clicking on it. The webpage also has indicators to let people know that the link to the form is a real encrypted link that will keep the information they submit secure. And you just have to look for a little padlock at the top of the page, and that lets you know that the information that you're putting in is going to be secure. All combined, we hope that these education and security measures will help people feel safe providing information to Public Health that will help both support our investigators to work as efficiently as possible and keep our community safe.